Hello, I am Dr. Farshad Amini Behbahani and this is short course of Iranian traditional medicine. In this section, we discuss about different kinds of diseases. There is a categorization in Iranian traditional medicine based on tissues, organs, which each part of them are similar to the other parts. We call this organ similar part organ, like meat, like nerve, vein, artery, bone, membrane, fat. And there are compound organs, those organs that are combination of several similar part organs. For example, muscle is combination of meat and nerve, or hand is combination of all similar part organs. Based on this categorization, we can imagine 4 kinds of diseases. These temperaments are those which involve similar part organs at their beginning. There are 8 without material distemperament, without any increase in hormones or any other matters. 4 of them are simple: warm, wet, cold, dry. And 4 of them are compound: warm and wet, warm and dry, cold and wet, cold and dry distemperament. And there are some material or humoral distemperaments. Wind distemperament, we call it sometimes material distemperament. Wind is not a humor, but is considered as a matter. Sanguine distemperament, yellow bile distemperament, black bile distemperament, and flake distemperament. And there are some diseases that involve compound organs but do not involve similar part organs. We call them composition diseases. Congenital diseases usually are categorized under composition diseases. Congenital disease could be disease in shape, for example, a cubic skull instead of a spherical skull. Could be disease in channels, for example, a narrow esophagus or wide mouth. It could be disease of spaces, for example, a small stomach or large bowel. A person with a small stomach become hungry soon and become full soon. This person needs more than usual meal in a day, but in a small amount. It could be disease of surface, a kind of congenital diseases. For example, a tongue without villus or a gut without villus is kind of surface disease. Or ichthyose as a surface disease. There are other diseases under composition disease, disease of position. For example, a limb that could not expand completely is a position diseases. Or a heart at the right side, it's kinds of a position disease. It could be disease of amount. For example, a small liver. Usually this person has small fingers. Or it could be disease of numbers. 6 finger instead of 5 finger. Or missing 1 finger. Or missing of 1 organ. There are another type of disease that involve both similar part organs and compound organs. We call them disease of integrity. When integrity of an organ is disrupted, we have disruption of integrity disease. For example, fractures, wounds, scratches, or burst of an organ. For example, stomach perforation is a disruption of integrity of stomach. And there are some complex diseases that are combination of all 3 other diseases. For example, acne or inflammation. In inflammation, we have some matter that can affect the temperament of the organ. It causes deformity, so it is a composition disease, and it causes this integrity of an organ and sometimes rupture. So it is rupture of integrity or disintegrity of organs. In next section, I will mention the signs and symptoms of different kinds of diseases. There are some other disease that initially is originated from these 4 kinds of diseases. For example, weakness. Weakness is sometimes because of distemperament. It's sometimes because of composition disease, or it's sometimes because of pain, for example, of inflammation. And sometimes this weakness because of low production of spirit, because of low consumption of food, because of too much working. You remember the causes of weakness of vital spirit. There are some obstructions. That's sometimes is because of inflammation. Sometimes is because of a narrow channel. It could be because of all these 4 primary diseases. Sometimes we have fullness. Fullness is a kind of disease that a matter gathered in an organ or in all of the body more than its capacity. Sometimes the capacity is low. We call them low capacity fullness. Sometimes the matter is too much. We call it true fullness. They have their signs and symptoms that I mention it in next sections.